Hello everyone, this is Dr. Sami from the Biostatistics Learning Group. Here we'll continue doing the data set use or secondary data set use. So conducting research using an existing data set is not always advisable, and there are several major areas of potential concern that should be considered. First, existing data set inevitably will not be a perfect match with what the researcher might have collected had the study been designed prospectively. So limitations relevant to what data are available must be considered. Second, research questions best answered by conducting an RCT cannot be answered by an existing data set, since there is no way to randomize participants into an intervention group after the data set has already been collected. Third, especially in the social sciences, history bias present as a potential problem, particularly if the dataset is more than a few years old. Fourth, at times there may be no available existing dataset to answer a particular research question, in which case a prospective study would be the only way to reasonably obtain results relevant to the research question. Now comes to an interesting part, which is selecting a dataset. Increasingly, making datasets available to researchers is seen as an ethical mandate. Nursing organizations, such as Quality and Safety Education for Nurses, QSEN, and various oncology agencies and groups recognize the importance of utilizing available data because it can facilitate results more quickly than when recruiting subjects is required using existing data. It reduces disparities in care by demonstrating best practices more quickly. Also, as previously mentioned, the avoidance of new research participants being subject to risks provides another major ethical benefit of using existing data. As per Table 1, researchers doing secondary analysis should seek out a dataset early in the process after reviewing the literature and determining potential research questions based on gaps in existing research literature. By this point, the researcher should have adequate expertise in these subject areas to be familiar with key concepts associated with the general research area. As research questions become more clearly defined, a more thorough analysis of existing literature is advisable to optimize expertise in the specific area and to generate potential sources of existing datasets. Having a firm understanding of the research questions will help guide the PI to datasets that include appropriate variables and samples and study design. A strong theoretical basis for the proposed research is extremely beneficial when determining the best possible dataset. Researchers obtaining an original dataset need to justify the importance of their research prior to their recruitment of the first subject. Similarly, those using an existing dataset to conduct research need to have a firm understanding of the theoretical underpinnings that justify the research when identifying the best possible dataset. Here are possible sources of existing dataset. First, the United States Census, then the University of California, San Francisco, then the Mayo Clinic, the Cleveland Clinic, QSEN, the nurses organization, and then National Center for Education Statistics, Science and Engineering Statistics, Cal Pass Plus, California Health Interview Survey, behavioral risk factor surveillance system through the CDC, National Health and Nutritional Examination Survey through the CDC, NHANES. Partners in info access for public health workforce. So PH Public Health Partners.org. And then data.gov. So table 3 contains some potential sources of data sets. Upon identifying a potential data set, the BI should consider the overall quality of data set. Areas of interest may include whether the dataset has the appropriate variables to evaluate the research questions, sampling methodologies, how the variables are defined and measured, and whether the sample size is sufficient such that the inquiry would be adequately powered. Whether there is excessive missing data and or high loss to follow up in a longitudinal study. The PI should consider specific aspects of the data, including original research proposals, recruitment plans, and research protocols. The PI of the secondary analysis will need to build a persuasive case that the original dataset is a good fit. The measures used in the original dataset most often will not be a perfect match with what the PI may have hoped for, but they may be sufficient, or they must be sufficient to potentially make meaningful scientific discovery. If the PI determines that a data set is of insufficient quality or lacking variables required to answer the research question, it's best to seek out a more appropriate data set. Attempting to make a data set work if it is not well suited to answer the research questions is futile. However, it may be possible to fine-tune the research questions to better match the available data set, so long as the revised research questions are still relevant and important. For proprietary datasets, the parent PI may be saving certain analyses for other researchers. Thus, it's important to discuss clear guidelines with the original PI to ensure the specific analysis of data being requested is permissible. If what's available to the PI to analyze it isn't sufficient, then alternative plans should be made to avoid wasting time. When focusing on a data source, the PI should collaborate with individuals who are expert in the specific data source being considered. Especially for large data sets, it's possible that coding and other data entry processes change over time, and the PI will need to make sure that the data is being correctly deciphered. Erroneous information could be reported if the PI has not gained sufficient knowledge of how to correctly interpret information from the data source. Ideally, the PI will work closely with the investigator from the original study. This is the ideal. Receiving code, books, and other information that can be used to correctly interpret data. But now, they are available on websites and you can just get that automatically. Some successful studies have occurred without substantial collaboration with the PI of the parent study. However, this should be done with some caution to avoid misinterpreting information. Certain types of data tend to have specific strengths and weaknesses. Administrative datasets, which are commonly used in college research, tend to lack the level of clinical details that might be useful since they tend to be originally obtained for non-research purposes. However, they are often well suited for examining healthcare practice variation and other questions for which an overview of trends would be enlightening. Whereas patient registries are well suited for more disease and or treatment specific data. Indeed, a registry tends to be best suited for research questions relevant to the population that's predominant within the registry. There is the potential to merge multiple data sets together. However, exercise caution as data corruption is an issue when manipulating data sets in this way. Specifically, there is a risk of merging variables that may not have been measured as reliably in some of the merged studies. Then we talk about IRB approval. Thank you for your time and see you in the next session.